me understand about the stem cell and what that is and how does it help us?
Stem cells have two capabilities. They can differentiate into other tissues. While we have cells in our bodies that are skin cells, they're nerve cells, bone cells, these are all differentiated. Hair cells are differentiated. Stem cells are undifferentiated. So the first important quality aspect of a stem cell is it in itself is undifferentiated, but it has the ability to differentiate. The second quality a stem cell has is the ability to renew itself, which is why our bodies can continue to turn over. There are also different types of stem cells. Not all stem cells are the same. So if you go back to what we most commonly hear about in the media are embryonic stem cells. So to make this topic a little more simple, essentially we have three sources of stem cells. One we call adult stem cells. We can get them from ourselves. We can get stem cells from any organ system, but the ones that are most accessible to us are the fat. In fact, our fat has the most stem cells, highest percentage of stem cells of any organ system in our body. We can also get them from bone marrow. We can also get stem cells from umbilical cord. We commonly use these in medicine. There's no controversy in that whatsoever. These are cells that are harvested after a baby is born and the mother has donated those cells. Otherwise they go off and they get destroyed or incinerated as biologic waste. The third place we can get stem cells are from embryos, embryonic stem cells. There's the controversy. We don't use embryonic stem cells in medicine. They have too much potential to differentiate into anything. A group of embryonic stem cells literally has the ability to develop into us, into a human being, which if you take a moment to ponder that is almost unthinkable, right? That any cell has the ability to do that in some mysterious way. So they're what we call totipotent or pluripotent stem cells. They can literally do anything they want. If they want to be a hair cell, they can be a hair cell. If they want to be a toenail, they can do that. A tooth, a bone, you name it. Those cells are capable of doing that. The cells in us, our stem cells in our bone marrow and our fat, they have less potential to differentiate, but they still have the ability to differentiate into different types of what we call mesenchymal cells, cells that we find within our body. For example, if you have liver disease and I want to give you a stem cell therapy either from your fat or your bone marrow, or I want to harvest it from an umbilical cord, those stem cells, when I give them to you, are not going to go to your liver and turn into a liver cell. That's not why we use them. We use those stem cells for their ability to secrete growth factors, cytokines, and these stem cells have the ability to home to areas of the body that need attention, and they secrete these amazing chemicals. And that's how they decrease inflammation, they modify disease, and in some cases even cure disease. We have a growing list of therapeutic indications we use stem cells for. Autoimmune disorders, rheumatoid arthritis, diabetes, neurologic disorders like multiple sclerosis, Parkinson's disease. They're now being used for autism. We use them a lot in our clinic for knee pain, for arthritis. We use them mostly for cosmetic purposes. Facial regeneration, hair rejuvenation, where they work extraordinarily well, especially when we combine them with PRP. What I want people to take home, this image that people get in their mind, that when they hear the word stem cell or stem cell therapy, they immediately say, well, isn't there some ethical considerations with that? Or isn't this illegal? And what they are referring to, again, are those group of stem cells, one of three where we get our sources, one of three sources, embryonic stem cells, which we do not use under any circumstance. And again, the other places where we get them, our own bodies, or from umbilical cords. And that's how we use them in medicine.